Mr. Chair, distinguished delegates, ladies and gentlemen, good afternoon to you all. We align ourselves with the statement of the G77 and China. We appreciate the theme of this session, linkages between ICPD Program of Action and Agenda 2030. Essentially, the elements streaming from ICPD POA have strong linkages with Agenda 2030 in the areas of universal health care, ending poverty, advancing education, increasing job opportunities, and reducing inequalities. Excellencies, the population of Bangladesh has increased fivefold from 29 million in 1901 to 170 million in 2018. We are now in the third stage of the demographic transition model defined by low birth rate and low death rate. Our efforts in health and family planning, education, women empowerment, and reducing child and maternal mortality led us to a demographic window of opportunity for reaping the benefits of demographic dividend. Accordingly, we are making necessary investments in education, health, and employment generation for young people. We are also addressing the risk of elderly and other vulnerable population by providing different allowances and expanding coverage of our social safety net. Excellencies, we have great success stories in achieving MDGs, and we are right on track to achieve SDGs. Over the first decade, our socio-economic conditions have improved remarkably. We have steadily maintained a growth rate of an average 7% during this time, which has now crossed 7.86%. The per capita income increased to $1,909. Our life expectancy increased to 72 years. Honorable Prime Minister Sheikh Hasina envisions transforming Bangladesh into a middle-income country by 2021 and a developed country by 2041. In this journey forward, we primarily depend on the young, who now constitutes 30% of our population, and the engagement of our women and girls to make real impact. We have solid policy frameworks under our perspective plan and the 7th five-year plan. Essentially, we have blended the elements of our international communities, such as IPD Program of Action and Agenda 2030, in our national plans and actions through a whole-of-government and a whole-of-society approach. While we are doing our part domestically, we have a long way to go to fully implement the ICPD Program of Action. For that to happen, we must forge partnerships at regional and global levels. We believe working together with our international partners, particularly in the following action areas, would make a difference. First, addressing multidimensional nature of poverty by fostering accelerated, inclusive, and resilient growth, increasing coverage and effectiveness of social protection, achieving gender parity, promoting financial inclusion, and providing a stable macroeconomic environment. Second, investing more to ensure better health coverage for our people. We have come up with a successful model of community clinics in Bangladesh, but we are facing challenges in the areas of NCDs, drowning, aging, and geriatric diseases, infectious diseases, health effects of geoclimatic disasters and arsenicosis, and reemergence of traditional diseases such as malaria and TB. Third, putting adequate resources for investment in education, eliminating gender gaps, and creating skills for the people to adapt to the changing needs of the day. Fourth, investing more for sexual and reproductive health, for more access to modern methods of family planning, and for reducing child and maternal mortality. Fifth, special care and opportunities that the elderly and the persons with different abilities in our society deserve. Sixth, investing more in accurate and disaggregated data by sex, age, and geographic area for formulating right kind of policies for our people. Seventh, We have given shelter and all possible human supports, including health and family planning, to nearly 1.1 million Rohingya people. It has been a huge burden on Bangladesh. We gratefully acknowledge the support extended by United Nations and other international organizations. We believe that the solution lies in their safe return to their motherland, Myanmar, as quickly as possible. Excellencies, as we are celebrating the 25th anniversary of the ICPD Program of Action this year, this session offers us a tremendous opportunity to reflect upon our successes and failure in implementing our shared promises. Rightfully, review and appraisal of the POA holds the key, and the recommendations of the Secretary General in his report in this regard are crucial for implementation of POA. Yet, we must have a more robust institutional mechanism, and we stand ready to engage with a wide range of national and international stakeholders to achieve that. I thank you all.